Hi, everyone. This is Dr. Paul, one of the core faculty at the Ascension Providence Emergency Medicine Program. I'm going to take you through a slideshow tour of our two sites. First is the Southfield campus. This is the emergency entrance where the ambulance traffic drops off the patients on the left, and then on the right side under that emergency sign, that is where the patients enter. This is the main communication desk of the department. The layout of the department is in the shape of a pentagon with 4 different nursing stations. And then off of a separate hallway, we have our annex, which is our psychiatric unit, and our express care unit. This is Chris. She's one of our health unit coordinators, also known as a HUC. She directs the traffic, makes phone calls. She acts as our unit secretary. And behind that glass window, behind her head, is the fishbowl where all the providers sit and dictate and spend a lot of our time when we're not with the patients. Off to the left is the patient hallway. You can see the numbering of the beds. This essentially goes out in a large circle, wraps around to where the right of this desk is, and that is the layout of the department. This is a picture of the hallway just to the right of that central communication desk. Sometimes we will use the hallway beds, as you can see there, when we are at capacity. But each bed, like room 31 there on the left, is an individual single patient room. Here's a picture of that room. You can see we have all the equipment you would need to run a code in each individual room: wall suction, oxygen, monitor, etc. There is also a television in all the rooms for the patients. This is the hallway leading from the ambulance entrance. That curtain covering the room to the right is our resuscitation bay. So the ambulance will come in, and if needed, they take a quick turn right into our resuscitation bay, which looks like this. Pretty typical resuscitation bay. This one is a little bit different than our first bed because it has most of our pediatric supplies stocked in this cart to the right of the EKG machine. You can see we have multiple ultrasound machines, rapid transfusers, vents. All the airway supply is behind the head of the bed. We have a second bed in the same bay, essentially a mirror image of the first, just without all of the pediatric stuff at the bedside for this one. This is our express care unit. We have 8 beds in express care. These beds are not stocked with as much resuscitation equipment because these are meant to be our low acuity patients, ankle sprains, simple lacerations, viral syndromes, things that we can get the patient in and out relatively quickly. Just down the hallway from the beds you just saw is the rest of our express care. Room 7 in the back is our ENT room, where we keep our slit lamp, our nasal packing. Any ENT supplies are usually kept in that room, so we try to put our patients in there where everything is available if they need those sorts of exams or treatment. That's it for the emergency department at Southfield. Now I'm going to go through some of the resources in the campus that the residents have access to. First is a lounge. This is only available to the residents with badged access. It's open 24 hours a day. There are vending machines, coffee, ping pong tables. There are workstations, a place to keep your coats. On the picture on the left, the door in the back in the middle is the entrance to the fitness center, which again is only available to the residents with badge access. There's a library at the campus, multiple workstations, books, and a librarian that's available to help track down any online journals, interlibrary loans. Our campus provides access to many different journals and resources electronically for the residents. Here are some pictures of the fitness center that is right off of the resident lounge. Multiple different workout equipment, TV, free weights, couple treadmills and bikes. Also at Southfield is our simulation center. We have a relatively new high fidelity simulation center. Our emergency medicine residents spend quite a bit of time here. Uses where our didactics will be every Thursday morning. This is one of our simulation mannequins in the simulation room. So you can see that it mirrors a typical emergency department room. We have high fidelity mannequins where we run simulations from behind a wall. We can talk through them, they blink, they lacrimate, you can intubate them, perform almost any procedure on the mannequin. This is what it looks like when we're running one of our simulations. So we have somebody behind the glass using the software to move the simulation along, and residents in the background performing the simulation case on the patient. Our sim lab has babies. We can do OBGYN simulations, adult simulations. We can simulate almost any type of case. And we do this with our didactics every Thursday. We also run many procedure labs and procedure teaching through our sim lab. Here's a picture of one of our airway labs. Again, just a picture to demonstrate how we use our simulation in our education, specifically with procedures. This is what the simulation lab looks like when we have some of our procedure days. This is from our boot camp during orientation for the ongoing interns every year. If you look on the left, we have chest tubes, airway, ultrasound, central lines. On the right, lumbar puncture, arterial lines. Here's another view of that same procedure lab. Back in the arms on the right side, you see the ultrasound guided IVs. We teach thoracentesis. All these are through various different mannequins in our simulation lab. Here is one of our rooms that we use for our small group didactics. And here is the larger lecture style hall that we use when we have didactics in a large group. Lastly, I'm going to go through some slides of our Novi campus, which is a few miles west on the freeway. This is Ascension Providence Park Hospital. We also call it the park. Here is the emergency entrance. You can see that the hospital looks a little bit newer compared to Southfield, and it is. Here's the waiting room. Once you enter through the waiting room, you go into an emergency department that has a similar layout to Southfield, more of a rectangular shape with multiple nursing stations. So here's, for example, Module B, Module C, Module D, Module A. These are all used for varying different purposes as our patient volume changes, boarding status changes, etc. Here is a picture of the fishbowl in the middle of the department at Novi. Similar to Southfield, this is where most of the providers will sit and dictate, talk to each other, bounce cases off each other, where we spend our time when we're not seeing patients in a room. Here's the resuscitation bay at Novi. Pretty similar layout to Southfield. Airway stuff at the head of the bed, dedicated pediatric cart for this particular bed. Everything else you would need for resuscitation at the bedside, essentially. And then here is B. This is in the same room, just another bed off to the left. Similar layout, everything you need right there at the bedside. Here is an example of a patient room at Novi. Again, just like at Southfield, everything that you would need to run a code is located in these rooms. A lot of the rooms at Novi will have a computer workstation in the room, which allow you to put in some orders, look up charts while you're seeing the patient, which sometimes can be quite helpful. Here's another version of the patient room. Some of the rooms will have recliners for family members, which patients and family appreciate. What is different from Novi compared to Southfield is we have a CDU, which is our clinical decision unit. This is an observation unit that we will staff and keep patients that are in the hospital for observation. The entrance to the CDU is through the emergency department. So because these patients are admitted under our care and observation, it's nice to have this just a short walk through a door from the emergency department if we have to go see the patients throughout the day. Here's a picture of the CDU hallway. And that's it. Thank you for watching the tour. Please contact us if you have any questions. Thank you.